And I don't know about y'all, but I take documentation very seriously because ain't nobody seeing me in court. Okay? Okay. Hey loves, welcome back to my channel. It's your girl Lisa, also known as Nurse Lee. If you're new to my channel and you're interested in nursing, beauty, and lifestyle, go ahead and hit that subscribe button and turn on your post notifications so that you're notified each and every time I post. So in this video, I'm going to be talking about great documentation skills and the importance of documenting as a nurse. So if you're interested, then just keep on watching. So first, let's talk about what documentation is. So documentation is a formal record detailing the nursing care provided to an individual patient. Okay? And it is very extremely important to document to avoid any lawsuits that may occur, if anything, God forbid, was to go left with your patient. If there's no proof of documentation, then you will not have anything to back you up in court. No proof of anything to back you up if anything were to go down in court. And you don't ever want to be put in that situation, right? Right. So that's why it is important to document when you are caring for your patients. Now I'm going to get more into what is important to document. You're on your nursing job, you're a new nurse, and even if you're not a new nurse, because there are some older nurses who forget to document certain things as well. So if you're a nurse in general, I'm going to talk about the important things that you need to document to cover yourself, okay? When you first come on the shift, document how your patient presented, okay? So let's say, for example, you're doing shift change report. You got report from the nurse who was caring for your patient. It's time for you to start your shift. You've done your rounds. You saw your patient. You made sure everything is looking good in your patient's room. Your patient is stable. Your patient is safe. Then you will go back to your computer and you will document in your nursing notes. Assumed, like what I say is assumed care of patients, or took over care of patient, and I'll say how my patient presented. My patient is stable, laying in bed, resting, anal ×3, call bells within reach, bed is in the lowest position, things of that nature. Just say a couple of things that you noticed when you went in the room, or that you actually did when you went in the room, right? So that's what you'll say in the beginning of your shift when you've laid eyes on your patient. If it's a patient with a high fall risk, you'll say non-slid socks on. Like I said, bed is in the lowest position, belongings are within reach. And then that's how you'll start your shift off. So I would like to call it, I guess, beginning of shift nursing note. That's what we can call it, beginning of shift nursing note. That is very important to have, so that as your shift goes on and anything were to happen to your patient, you will, the doctor or whoever can look back on your note and be like, okay, well, in the morning, this is how the patient presented. This is what the nurse said. This is how the patient presented. And now this is how the patient is presenting. And then you'll just continue your notes from there, But it's very important to have that beginning shift nursing note when it comes to taking care of your patient, so that, it's documented how your patient presented when you first came on the shift. It's very important to also do rounds after you get report, so that whatever the nurse told you is matching. You know what I mean? Another good documentation skill I want to talk to you guys about is to chart on your patient as soon as possible. Chart on your patient ASAP, and don't wait till last minute. And when I say that, I mean to, like, a head-to-toe assessment, right? You've done your assessment on your patient. If there's time to document within that hour or two that you've done that assessment, do that. Don't wait till the end of your shift and go through all 5 of your patients and document all 5 of your patients at the end of the shift, because not only will you not leave the hospital on time, you're going to be a little frustrated because you're going to find yourself rushing to get it done because you know it's almost time for you to clock out, or you're going to stay after to document that stuff. So you need to, it's very important to try to document in real time. Try to document in real time. You did your assessment, all right, let me document my assessment now. Some nurses like to take the computer in the room, or if there's already a computer in the room, they'll just do their assessment and document that assessment right then and there. And that's very good to do, so that either you won't forget to document it, or you don't find yourself rushing at the end to hurry up and document your assessment or whatever information you've gathered from your patient. So document ASAP. You know, let the documentation be ASAP and don't wait till last minute. It's also important to document ASAP because let's say, you know, you did your head-to-toe assessment, everything was fine with your patient. A couple hours into your shift, your patient is now showing changing condition, right? And it's like, all right, now things are speeding up, and it's like, all right, I have to hurry up and call the doctor. I have to hurry up and carry out these orders that the doctor has placed for my patient. But there's no documentation to show that you even assessed your patient. You know what I mean? So it's very important to document in real time because the doctors are even looking to see, okay, how did the patient present at the start of shift in the beginning? How was the patient looking? And you don't even have any documentation to show proof. That could also bite you in the butt. It's like, okay, did you actually do your nursing care when you first got on the shift? So document to cover yourself, you guys. It's very important. Document in real time as much as you can. I know that sometimes you do your assessment and then something's going on with your other patient and you have to run and do something with your other patient and you don't have time to document in real time. Just always remember in the back of your head that, hey, I didn't document that. I need to go back and document instead of waiting till the end of the shift. If you don't know, I'm a med-surg nurse. We typically have up to 5 patients. It can get very busy. Anything can go down with any of our patients at any time. So it gets difficult to document in real time, but I try my best to document in real time. So number one, I don't stay after so late. And number two, if anything were to go left, I would have that, you know, previous documentation to back me up. So that's very important. Speaking of me being a med-surg nurse, it is required that in my facility that we document a head-to-toe assessment once per shift. So document your head-to-toe assessments. Is very, very important. We document it, like I said, once a shift, and then if anything were to change with our patients, we document that change that had occurred. Not only would you document that change that had occurred, also include in your nursing note what the change in condition was with your patient. Hey, for example, let's say your patient had chest pain. And it's also very important to address your patient's concerns and their complaints. So your patient tells you they have chest pain. Take that very seriously and tell the doc, assess your patient first, then you tell the doctor what's going on with your patient, carry out the orders, whether it's EKG, troponins to be drawn, giving nitro. When you do all those interventions, make sure you include in your nursing notes what had occurred. Patient had chest pain at this time. Nurse assessed patient and contacted Dr. So-and-so at this time. Dr. So-and-so placed orders to carry out XYZ. You will list everything you did at the certain time. I like to put timestamps at the certain time and have that documented so that that's your proof as to what you did and what happened during your shift. If anything was to go down, you have that proof that it was documented. The judge or whoever is in court will look at your documentation. Well, Lisa did this, that, and the third to save the patient. You know what I mean? So we're not hoping to go to court. I'm not hoping to go to court, but documentation is very, very important to save you. So other things to remember to document, I would say, is your I's and O's. Sometimes we overlook those things, but intake and output is very important to document what your patient takes in terms of the fluid they're drinking, nutritional status they're taking in. Document that. Document their output of what they're urinating their bowel movements. That actually helps out other nurses who come on the shift. If you may forget to let the nurse who's coming on, if you may forget to let her know, him or her know that the patient urinated or had this many bowel movements, they can go back in your chart. They can go back in the patient's chart and see what you documented, whether it's 3 occurrences or 2 occurrences or how many, the quality, the quantity. They can see all of that because you've documented it. So it's very important to document your I's and O's. I know that's something that I may forget to tell the nurse that I give report to, but I do make sure I document it so that they can look back on the documentation and see, see what happened with the patient or what the patient did. What else? Daily weights. If there's any daily weights that is ordered for your patient, don't forget to document your patient's weight. If there's an IV that your patient, document your patient's IVs, the status of your patient's IVs, clean, dry, intact. If your patient's IV has infiltrated, take it out, obviously, but also document that patient's IV infiltrated. If the patient's arm swelled up, document that the arm was swollen. And then that's covering yourself, that's definitely covering yourself to document status of IVs and whatnot. So I know it sounds like a lot to document, but if it wasn't documented, it wasn't done. I've heard that all the time in nursing school, you guys. If it's not documented, it wasn't done. It didn't happen. And it's true. It's very, very true. If you didn't document it, it wasn't done. So, and nobody wants to go through their nursing shift without any documentation, because it's like, did you even work? Did you even take care of the patient? You know what I mean? Did you do your job? It doesn't look like it because it wasn't documented, and they go off of what was documented. That's what we go off of. So document, document, document. CYA, 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 y'all. So that, you're clear, you stay free from any issues or any, trouble that may occur. Your name is cleared. You don't have to encounter any lawsuits or anything like that, because at the end of the day, it's very important that we stay clear from that as a nurse. So I hope you guys get the point. You guys understand where I'm going with this. This is your proof. This is what will back you up in the long run, is just taking a second to jot down notes or click off documentation. So take it very serious, you guys. I take it very serious as a nurse. And I've heard stories of other nurses who have gone to court and it did not end well. So take it very serious, document everything regarding your patient, and that's all I have for you guys. So if you found this video helpful, please give it a thumbs up. If I forgot to mention anything that you guys may document that's very important, please leave it down in the comments box below. This is a learning environment. I'm still learning. We're all learning. So leave it down in the comments box below so that we can all have a conversation about it. So thank you guys so much for watching. If you haven't already hit that like button, go ahead and do so. And subscribe to my channel for more content. See you all next time. Bye, guys.